Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'll be going over day 5 of National Public Health Week, which is rural health. Believe it or not, there's a lot of disparities between urban health and rural health, which I'll be going over in a moment. So let's get started here. So, what are the health consequences of living in a rural area? And there's 14% of Americans that are living in rural areas, which is why we need to pay attention to this and understand the root cause of some of these disparities. Higher rates of high blood pressure and diabetes, which are fundamental chronic diseases which lead to other diseases. These are actually increased rather than in urban health. Now, shifting focus from health consequences to looking at racial equity compared to urban residents, rural residents are at higher risk for poor health outcomes because of the range of health disparities they face. Racial, ethnic minorities, and tribal groups are at higher risk for poor health outcomes compared to non-Hispanic white adults. Um, and then these health disparities include poverty, food deserts, otherwise known as food apartheid, and then more exposure to specific environmental hazards and less time for leisurely physical activity. So as you can see, a lot of this has to do with built environment, the lack of it within rural areas, which is why a lot of times physical activity is not possible. And other things that is affected is accessibility to healthy foods, which needs to be addressed. So, what are the strategies in rural health? And a lot of these, I'll disclose this, a lot of these are from NPHW, where they're providing 4 areas that the topic touches on. So the strategies include effective, of course, time-tested strategies in multiple studies. And these studies have actually shown that certain interventions do work in the rural community areas. For instance, school breakfast, that is to help food insecurity reduction and improvement of student diet, health, and academic achievements. Next is vocational training. Research suggests that vocational training actually has a beneficial effect among high school students. And this helps strengthen the workforce as well, which is available in rural communities. And this sets residents on a path to success in and improve their communities. Another interesting factoid is that naloxone training individuals in the public to administer naloxone and then curb opioid overdose. So celebration is something to note before we conclude is that nonprofits like Holler Health Justice have provided Appalachian, Black, Indigenous, and people of color with abortion funding, practical support, as well as distributing N95 masks and units of hand sanitizer across West Virginia during the COVID-19 pandemic is another wonderful thing to celebrate. The Alaska Native Tribal Health Consortium, along with 10 tribes and 10 tribal health organizations, offered tribally sponsored health insurance to qualified Alaska Native and American Indian people. This medical care or access makes medical care all that more financially accessible. Finally, I wanted to make a comment on the pipeline because I had, back in the day, signed a petition to stop the building of the pipeline due to, in many places, contamination of the water or something else. Um, so in 2021, there was an agreement to close down the pipeline, and also because this is such an environmental hazard, potential environmental hazard. So as you can see, there's a lot to go in rural health. There's disparities, there's equity related concerns, and then finally there are certain areas to celebrate, and we can never forget that. So I hope this makes sense. Thank you for listening.